So now we're going to transition into our town hall. So this is a portion where we have been hosting these quarterly for the last year. Actually, this is our fourth one, as a way to bring back something that was done years ago, where providers would meet in person and work with each other and talk together about problem solving, or hear from each other, and we really want to recreate that space as much as possible. And so because of COVID, we are doing it virtually, but also because of the virtual setting, we're able to get a lot more people in the room, so to speak, together to learn from each other. So for today's town hall, we have a couple of quick presentations, one from the New York Public Library, and then one is going to be from me in a second, introducing our new internal networking tool called UpSquad. And if you registered for today's event, you registered in UpSquad. So I'm going to do a quick demo of what this looks like. We really want to use this platform as a way for you to engage with each other, to post questions, to post resources, events, anything that may be of interest to the full community without bombarding your inboxes. Believe me, we hear you. We know you get 1,000 emails a day, and you don't always have a chance to read through them. And so we want to create a space where you can go, you can search by keyword to get help in a topic that you're looking to get help from. If you're in Long Island, maybe you can get help from someone in Staten Island. By visiting this platform. And then we'll also post resources there to help kind of cut down on some of our million reminder emails. Alrighty, so really quickly, I will show my screen. So when you log into UpSquad, this is what you'll see. This is our internal community. You can only join if you have the code, which is RORGNY 2021. And that just puts you in our community. There are different squads here that you can join. And this makes it so if you are a medical provider and you join the medical provider squad, you'll see all of the posts that go to medical providers. Or if you join medical provider and coordinator and parent, maybe because you are all three, you'll see posts for all of those squads. It's a social networking platform. I believe it is pretty intuitive. Here you can see we started to post some things, playing around with it, but we're really going to officially launch it next week, or at the end of today, so really Monday. But you'll see here I posted, a research study that might be of interest. Somebody liked it. Thank you, person. We posted, Carrie posted our posters, which are now in simplified and traditional Chinese, as well as in English and Spanish. So there's a way to access them there. This was me just asking a question. So all sorts of things that you can do. Someone commented, you can talk about it through there. But the other really cool thing you can do here, aside from posting these different categories, when you create a post, if you want it to send an email to everyone in that squad, you can. I promise we are using that sparingly and only if we feel it is very, very, very important. You can add photos. Here's where you select the audience, entire organization, specific squads, select different categories depending on what it is. And then the other piece that you can do is you can send messages to different colleagues. So if you realize that someone posted something and they're a medical provider you've never met before, but you really want to talk to them about what they've done because they've figured it out and you haven't figured it out yet, whatever it is, you can chat them just like you would in, any sort of instant messaging chat. And then the other cool thing here is you can actually schedule meetings. And so this already has a paid version of Zoom in it. You can schedule a one-on-one meeting with that person and it'll send a calendar invite. Or you can schedule a group meeting with a group of people like we did here today. We had 66 people registered. So and you can see yesterday we did Carrie scheduled an event for us to do a run through of the meeting. So it's a really cool, simple platform to get to know your colleagues a little bit better and to, you can see here with all the different people who have joined. Anyone is welcome to join this community. You can see that, if there's another provider at your site that maybe is not super well versed in the Reach Out and Read program, but wants to be connected to all of this, send them the link to register. We'd like to get this community as robust as possible. For that reason too, we're also inviting community partners to register in this community. Because if there's an event happening at the local library, the library can post about it and know that it's going out to our 1,000+ providers. Hopefully, if we have 1,000+ people actually join the community. We are just piloting this for a year and then seeing where it goes from there. But we're really hoping this is answering the request we've received from multiple providers to connect with other providers across the network and stay connected and learn from one another. We're a small but mighty team internally, managing everything behind scenes. So we want to give a little bit of autonomy to everyone in our network to be able to meet with each other and learn. All right, so speaking of community partners, I am now going to pass it on over to the New York Public Library. And I see Eva Shapiro.
Hi, Kristen. Hi, everyone. Thanks for having us. Kristen, am I going to share the presentation or are you I'm sharing it?
Yes, you're sharing it.
Okay, hold on one sec. My colleague Amber Moeller is also here. She can introduce herself while I pull up the presentation.
Or wait, I have it up. I can do it too.
While we get our presentation pulled up, I'll go ahead and introduce myself. Hi, everyone. I'm Amber Moeller. It's great to be here. I'm one of NYPL's 4 early literacy coordinators. I work primarily with Staten Island, but also parts of Manhattan and help out generally everywhere. And we have a little presentation on our library services for you today. So Eva, you're still muted. Oops. All right, hopefully we're all set. Do you see the presentation? Okay, awesome, thank you. So as we mentioned, we are from the New York Public Library. So that means that we represent Manhattan, the Bronx, and Staten Island. That includes 88 neighborhood library branches. 55 of our branches are currently open with browsing restored. So some services are restored as well as computer reservations. And some great news is the rest of our branches, the additional 30, will be opening in July. So all 88 will be open very soon. And to find the local libraries nearest your clinic or where you work, or if you want to help families find it, the best resource is just to go to nypl.org/locations, which is right there. And if you're looking for library services in Brooklyn and Queens, just keep in mind that those are separate library systems. They do offer most of the same services, and you can find out about Brooklyn and Queens Public Library Services at their website. All right, so of course, the #1 service we want to talk about is getting a library card for families. Library cards are free, and they allow you to access all of our books and materials. So right now, you actually can get an e-library card, a digital one, on our website, and you just need to have a New York address, and then you can go into a physical location to get the card. But if a family is just looking for electronic resources, ebooks, we have a lot of resources like Tumble books, which are animated books, and they don't want the physical card. They can just use that, or go into any of our open locations. You do need to either work in New York be a student in New York or live in New York to get a library card. And in addition to the books, like I mentioned, there are lots of fun other resources. We have electronic read aloud books that are really popular, and we just started circulating a new material, a Launchpad, which is a preloaded digital tablet. So something else that you can now get at your local library.
And your library card gives access to a lot of free resources, both virtual and in person. And as Eva mentioned, we have 55 locations open right now. We're working on restoring services at our other locations. So right now we have available, you can request items for pickups. You can go online to nypl.org, or you can call our hotline, Ask NYPL. That's 917 Ask NYPL, or call your nearest local branch and request that items be reserved for you that you can then go to a location and pick up. We also have limited browsing right now. It's limited to 30 minutes for the time being, as well as computer reservations, which are 45-minute sessions. You can reserve a computer on our website online, or again by calling. And we have lots of virtual programs right now. We're still doing the majority of our programming virtually for the time being. So these are live through Google Meet or Zoom with our librarians. And we have programs for children, teens, and adults. And you can find out about those on our events page.
All right, so our really great resources we wanted to focus on are our early literacy resources. So all of our early literacy resources are best accessed at this webpage, nypl.org/storytime. And we have available here a whole host of pre-recorded video content. We have a multilingual channel. We have story times in a host of different languages, including Spanish, Japanese, Chinese, Arabic, just to name a few of them. As well as different themed story times. We have a whole section of STEAM story times that include hands-on activity guides, so families can do a hands-on activity guide after watching the video. In addition to the different online story times, we also have a lot of downloadable resources. We have at-home story time guides that are available that kind of show families how to recreate story time at home. We have at-home play activities that show a lot of really fun play, different really hands-on play and sensory activities, in addition to those STEAM activity guides. And these are all available in English and Spanish, and our play activity guides are available in Chinese as well. We also have a downloadable activity booklet that again just has a host of different activities with really easily accessible materials at home for families to complete. The download is available on the website, and then all of our branches actually have the printed booklet of activities that can be picked up at the local library. So that's just some of our resources. And I just really wanted to important to note, none of these require a library card. So these are all free and accessible to anyone. You do not need a library card to access any of these resources. This page also will link you to sign up to some of the virtual programs as Amber mentioned. So we have online story time through Google Meet, as well as caregiver conversations, which are really for families and parents of children and caregivers of parents, and they focus on different topics of interest. And those you do need a library card to sign up for.
And we have more resources that we've expanded, like our remote offerings for resources. So that includes Storyline, which we're really excited about. It's our Dial a Story program. So you can call that Ask NYPL hotline and hear a children's book performed by one of our librarians. And we offer that in English, Spanish, Russian, Mandarin, and Japanese. That's also available on Spotify and Apple Podcasts, because those are accessible to you. We also offer a shelf help service. That's personalized book selection. So you get 5 hand-picked books from your local librarian. And those can be children's books, they can be adult books, they can be teen books, anything that you ask for. The librarian will pick out selections just for you. And you can fill out a form online on our website, call the Ask NYPL hotline, or there's also paper forms that you can request and fill out at a local branch. We have virtual career services. So our trained staff members are offering one-on-one by phone and virtual through Google Meet appointments for job search help, resume help, interview help, all that sort of thing. And we also have a really great partnership with Action NYC for free immigration legal help. So that's Action NYC staff members at library locations who are offering that. And you can find out on our website, or the number is also in this presentation.
All right, so those are just some of the services we wanted to mention. We also wanted to do some suggested ways to partner with the library. So scheduling library card signups, obviously you really want to get library cards out to families. So scheduling a local librarian to come into your clinic to do library card signups with families. You can schedule a librarian for story time in your waiting room, or if you're having any sort of community event. We also offer caregiver workshops, so we can connect you with a librarian to host an early literacy workshop or to talk about specific library resources. We have the name of our colleague who unfortunately could not join us today, but she manages a lot of our health outreach, and her name is Samantha Terrazas, so her email is included there. You could also reach out to either myself or Amber to help coordinate these as well. So that kind of concludes our presentation. Hopefully it was just a little quick overview, but we're really excited to share our resources with families. Again, everything is free at the library, and we are here to hopefully partner with you at some of your sites.
Wonderful, thank you so much. All three public libraries have an insane amount of resources. So we are excited to be partnering so closely with NYPL, and we also work closely with Queens and Brooklyn too. So if you're in those boroughs, fret not. And also my Long Island upstate friends, we have connections to our Long Island libraries as well, and upstate libraries. So if anybody needs help connecting with their local library, please reach out to me or to Nardine, who is Michael's replacement, which we're still in denial about. We want to keep them both, or Carrie. So we can all connect you in any way, shape, or form. Thank you so much, NYPL. We really appreciate it for being here today. So now we have one other guest speaker, and I am going to pass it on over to Carrie to introduce her.
Thank you, Kristen. Excited to start by telling you guys a little bit about an initiative that we are undertaking with New York State. And that is how we came into contact with Melody Baker, who I'll be introducing in a moment. So this initiative is called the First 1,000 Days on Medicaid. And it's been going on in conversations now for about 4 years. But what this is, it's a 2-year pilot that was initiated by New York State to direct Medicaid funding to preventative interventions during a child's first 1,000 days of life. So we have been working with managed care plans as well as New York State in 3 pilot sites, one in Brooklyn, one in Queens, and one in the Bronx, to fund our Reach Out and Read programming through Medicaid services. And we are excited to announce the launch date of this is officially going to be on June 23rd. So very soon coming up here, and that will start the 2 years that we have in this pilot. And Melody has joined in a unique role that is really meant to look at the community resources and how we can utilize that. And not only is she able to support the 3 sites that are in our pilot, but she has also offered her services to Reach Out and Read's network. So I'll give it over to Melody Baker to introduce yourself and tell us a little bit about how you can support the providers we have on today.
Thank you so much, Kari. So first of all, I am so impressed with the work that Reach Out and Read is doing. Prior to my current role, I was the Director of Education at United Way, Buffalo Erie County. And that was my first experience really learning more about Reach Out and Read. I became a huge advocate of your work. And it was just absolutely thrilling to attend the clinics and see all the partnerships and everything that is going on. So when I was asked to be a part of the first 1,000 days, and learn that Reach Out and Read was one of the key strategies to improving health outcomes, I was ecstatic. I was thrilled. I've been just so impressed with the work that is being done. And from an education standpoint, it truly, as you already know, it truly does improve all health outcomes. If children and parents and their families have better access to resources, it improves long-term outcomes, which is what we're pushing for. So I'm working with Rockefeller Institute of Government, and I'm leading the research and the evaluation for the first 1,000 days in partnership with the Pritzker Foundation. Long story short, my work is twofold. Number one is to provide collective impact support, to really highlight organizations to leverage existing resources to expand the capacity of the providers. We understand that providers can't do everything. And for so long, we've been pushing everything onto the providers because you have more access to underserved populations than any other field, more access than childcare, more access than any field. So unfortunately, you have had to carry the heavy burden at many times of doing and being the be all for everyone, the catch all for everyone, because of your high touch points. So my work is centered around making sure that we support your work. My final product or final deliverable with this particular project is essentially learning from your work, writing recommendations to the New York State Department of Health, and to essentially promote that, or essentially confirm that these organizations working together, and we already know this, but you know, more data and policy agendas all work very well to make sure that there are lines and there are resources for this very important evidence-based work. So my final deliverable will be recommendations, and that information will be coming directly from you, from the providers. And those recommendations essentially will say that these resources improve outcomes for children and families between the ages of 0 and 5. This is how you can help us continue this work and make sure that that providers providers do receive the resources that they need to continue on. So I'm a huge fan of Reach Out and Read. I'm thrilled to be a part of this in such a meaningful way. And please reach out, let me know if there's anything I can assist with. Again, my work has everything to do with connecting, providing coordination supports, collective impact, and then ultimately I'll be making recommendations, essentially writing a report to the state saying, these programs need to be funded indefinitely. They are working together to truly improve outcomes for underserved populations. So that's my work. Thank you so much, Carrie. Thank you, Kristen, for allowing me to be a part of this meeting. It is absolutely amazing.
Thank you, Melody. And I'll also add that Melody is on UpSquad. So you can actually message her on UpSquad, or you can contact one of our Reach Out and Read staff members, and we're happy to connect you with Melody, and are so grateful for her support. And we're happy to keep you updated on this first 1,000 Days initiative as it finally launches and as we go through this 2-year of the pilot. So thank you, Melody. And
thank you.
Back to Kristen for our discussion portion of the town hall.
Thank you. We are so excited to have Melody in our network and to be working so closely together. So now I know we are about 5-10 minutes behind schedule. So what we're going to do, we've had a few people who had to drop off, but we're going to go into 3 different breakout rooms to just have an opportunity to discuss anything that was talked about today, especially in Dr. Willis's keynote and how it relates to the work that you do every day. We are going to randomly place you all in breakout rooms. So I'm sure that will sway the conversation because I know we have a variety of representatives here today. So the breakout room will be about 10 minutes, 10-15 minutes, and then we'll come back and do a quick share out and close out for the week. All right, everyone is coming back. Sorry, my warnings were not actually accurate in the slightest because we started getting into a really good discussion and I didn't want to leave, but that's good news. So if Michael or Carrie, do you want to share 1 or 2 takeaways from your room in the next 90 seconds?
Yes, absolutely. Oh, go ahead, Carrie. You got it.
I have to finish the thought because we were in the middle of a thought when we got pulled back. We were talking about how unfortunate it is that we're not able to distribute books to the older age children. And we talked about the ideas around book drives, if the clinic has extra funding to be able to provide that. That there are some really unique examples that our clinics have tried, and maybe we can post that on UpSquad, some examples. That would be a great place to put them. And we've talked about what it would look like if Reach Out and Read stretched younger, stretched older. Nothing decided, but definitely aware that it is unfortunate when those older kids come in. So the other things that we kind of discussed briefly, we shared a lot of stories about the real impact of the books and how they can really impact that early relational health, that relationship between the parents and the child. Had some really great stories about that Dr. Corey shared about how older child actually came in with a book and was just an avid reader. And so they could actually see the fruition of that Reach Out and Read programming. And Melody and Gary shared examples of how in their with the immigrant populations, the importance of meeting those populations where they are and providing supports where we can. And that a lot of times came from the library coming in to provide those read alouds in the waiting rooms. And then as a caveat at the end, we just discussed how moving forward into a post-COVID world, whenever it's going to be a while, we foresee, until we get back to that opportunity to have librarians in the waiting room. So thinking of unique solutions on how to bring the community and the community resources to the families that come into clinics. So I hope that was brief enough and comprehensive enough.
Yes, I will share super briefly because I know we have a minute. I know Kristen might want to share a few things, but basically first talked about it's great that early relational health is so science-based, but we find in the clinics, we try to stray away from talking too much about the science and more so just praising parents for what they're already doing and in sort of a positive feedback approach. And then secondly, some of the challenges sometimes is you don't want to overstep and sort of insert yourself into the relationship of the parent and child, but we can do that in a way by, not making assumptions about what they're doing and just asking them questions and just making a very parent-centric, child-centric approach. So that's my takeaways.
Thank you. And then quickly from our group, the last thing we discussed was actually training more people in the medical office in Reach Out and Read. And so not just having the medical providers trained, but having reception staff, having volunteers trained in all of this. And so if it can't necessarily happen in the well child visit because of extenuating circumstances, ideally best case scenario, it happens every single time, but we know that's not reality just because life. And so having more people trained in this will be better and more well-rounded, and having everyone aware of Reach Out and Read, and being able to give out the books and to maybe not necessarily give out the books, but talk about the importance of reading. Alrighty, so we are exactly at 2:00. I want to thank our last group of survivors here, and especially I want to call out two of our board members have been here this entire time, Gary and Sergey. I've never worked for a nonprofit that's had board members this engaged before. So it's just incredible to see how dedicated you are to the cause that you support. So thanks for sticking in there with us.
Yeah. Thanks for everything you do.
And Sergey actually gave us a read aloud in Russian. So it's on our Facebook page. All right. Thank you so much to everyone who joined today. Congratulations again to all of our winners. We are honored to be working with everyone here, and we truly appreciate all that you do. Enjoy your weekend.
Thank you.
Thanks, everybody.
Thank you all. Take care.
Thank you.
Thank you, Dr. Reynoso. You too. Yes, absolutely.
Thank you.
Bye, Melody.
Bye. Thank you, everyone. Bye-bye. Thank you.
Bye-bye.